Introduction. What is mental health? Our mental health, our interpersonal, psychological, and social well being are all part of our mental health. It has an important on the way we think, feel, and behave. Furthermore, it also influences how we cope with stress, interact with people, and make decisions. Afterward, mental health is a crucial stage at all stages of life, including childhood, adolescence, and maturity. If you have mental health difficulties, your thinking, mood, and behavior may be altered over the course of your life. Many variables have a role in mental health problems, including biological variables like genes and brain chemistry, then life experience such as trauma and abuse, and also family history of mental health problems. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I am Nur Safika binti Erizal, and I would like to talk about 5 types most common mental disorder. The first one is anxiety disorder. This disorder can cause people who suffering it to experience depressing and frequent fear and apprehension. This disorder also can last up to 6 months or more. Anxiety is actually a blanket term that includes a lot of specific disorder, including generalizing anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. The second one is mood disorder. Estimated that 1 in 10 adults are suffer from this kind of disorder. Depending on the specific disorder, people may experience an ongoing sad, anxious, or empty. They are feeling like they are hopeless, low self-esteem, excessive guilt, and decreased energy more, and a lot more. The most common mood disorder are major depression, dysthymia, bipolar disorder, substance-induced mood disorder. The third one is psychotic disorder. Those who are suffering from psychotic disorder may be unable to know what is real and what is not. This is extreme stress or trauma, and some other from of drug abuse may play a role in the development of psychotic disorder. The most common psychotic disorder include schizophrenia, schizoaffective disorder, brief psychotic disorder, delusional disorder, and substance-induced psychotic disorder. The fourth one is dementia. Those who are suffering from dementia-related disorder may experience a decline in their cognitive abilities. This is often severe enough to impair their daily life and independent function. Other forms of dementia take the term of Parkinson's disease, frontotemporal dementia, Huntington's disease, and Rett-Korsakoff disease syndrome. The last one is eating disorder. This condition can cause unhealthy eating habits to develop, such as an obsession with food, body weight, or body shape. The common of symptoms include the severe restriction of food brings, or purging behavior such as vomiting or over-exercising. The most common of eating disorder include anorexia nervosa, bulimia nervosa, binge eating disorder, pica eating disorder, and rumination disorder.
Assalamualaikum and good day. My name is Nur Amalia binti Basri and my metric number is 20142018, and I will talk about the causes that impact on mental health. For the first one is abuse. Abuse may be physical, sexual, psychological, or verbal. It may not always be evident or easily recognized. Regardless of the form it takes, abuse cannot be tolerated. Children need to be protected from abuse and help to overcome its negative effects. And the second one is family breakup or loss. Separation can affect families in a lot of different ways. Some kids are more able to talk about their feelings, but most, particularly younger children, will show how they feel through their behavior. Younger children who have previously been confident and calm may seem anxious and want to stay close to parents or guardians. Some kids may get angry or get into fights more often than usual, while others trying to be really good and please the adults close to them. For the third one is physical ill health. Disease, injuries, and other physical problems often contribute to poor mental health and sometimes mental illness. Some physical causes such as birth trauma, brain injury, or drug abuse can directly affect brain chemistry and contribute to mental illness. And the fourth one is bullying. Bullying is when a person is repeatedly and intentionally subjected to verbal, physical, or social behavior that cause physical and psychological harm. Bullying can happen to anyone, anywhere. It can be in schools, at home, at work, in online social text messaging, or via email. The fifth is legal and financial problem. Whether you lost your job or suffering from poor mental health or physical health or you separate from your partner, changes like this can mean that you struggle to pay your household bills and debts. Having to adjust to such a financial change can be difficult, even if it's only going to be for the short term. The last one is social or cultural expectation. Living in a community that rejects aspects of your culture such as identity, belief, or sexual orientation can have negative impact on your well-being. If you live where the dominant culture is different from or less tolerant to your own culture heritage, or you have parents from different culture background, you may experience some conflict around your cultural identity.
Hi everyone, my name is Nur Iza Atira binti Zaidi and my matric number is 2014-20131. My part is how to get rid of mental health, which means mental health treatment. Treatment for mental health disorder is not one size fits all and it does not offer a cure. Instead, treatment aims to reduce symptoms, address underlying causes and make the condition manageable. You and your doctor will work together to find a plan. It may be a combination of treatments because some people have better results with a multi-angle approach. Here are the most common mental health treatments. Firstly, medications. The four main categories of medications used to treat mental health disorders are antidepressants, anti-anxiety medications, antipsychotic medications, and mood-stabilizing medications. Which type is best for you will depend on the symptoms you experience and other health issues you may face. People may try a few medications at different doses before finding something that's right for them. Second treatment is psychotherapy, which is talk therapy is an opportunity for you to talk with a mental health provider about your experience, feelings, thoughts, and ideas. Therapists primarily act as a sounding board and neutral mediator, helping you learn coping techniques and strategies to manage symptoms. Third one is hospital and residential treatment. Some people may need brief periods of intensive treatment at hospital or residential treatment facilities. These programs allow an overnight stay for in-depth treatment. There are also daytime programs where people can participate in shorter periods of treatment. Lastly is lifestyle treatments and home remedies. Alternative treatments can be used in addition to mainstream treatments as a supplement. These steps won't eliminate mental health issues alone, but they can be helpful. They include sticking to your treatment plan as closely as possible, avoiding alcohol and drugs, and adopting a healthy lifestyle that incorporates foods that may be a benefit to your brain. This includes omega-3 fatty acids, a type of fish oil that occurs naturally in some high-fat fish.
Conclusion: why should we be concerned about mental health? It affects how we think, feel, and act as we cope with life. It also helps determine how we handle stress related to others and make choices. Mental health is important at every stage of life, from childhood and adolescence throughout adulthood and aging. Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. Thank you.